Recently, there was a news in a local newspaper that after the cremation and performance of the last rites of the patient arrives home much to the surprise of his relatives. There was a certain Banerjee who was admitted for COVID-19 in a hospital, and a certain Mukherjee who was also admitted in the same hospital. The condition of Mukherjee deteriorated and had to be shifted to a higher facility for better management. However, accidentally, the case papers of Banerjee went into the Mukherjee's file, and along with Mukherjee, Banerjee's case papers were transported to the other facility. The condition of Mukherjee deteriorated and he ultimately succumbed to the illness, and when the relatives were summoned for claiming the body, it was the relatives of Banerjee, due to the interchange of case papers, who, after viewing the body from a distance because of COVID-19, claimed the body and performed the last rites, as they could not properly identify the body as to that belonging of their relative. The condition of Banerjee here in the original hospital improved and was medically discharged after a week, and when the relatives were summoned, the relatives of Mukherjee appeared on the scene due to interchange of the case papers, and the mistake was identified when they said that it is not their relative. Because of this, the relatives of Mukherjee filed a suit that because of wrong case papers along with their patient, there was wrong treatment rendered, and they said about the inefficiency and the negligence of the hospital. How could this have been prevented? Identity of a patient and verification of the patient identity has to be established by various patient identifiers like patient name, UID number, identification marks, Aadhaar card or any other government document, as well as addressing the patient by name while administration of the treatment to the patient by mentioning, "Good morning, Mr. Banerjee. How are you feeling today? How is your abdominal pain?" Or, "Good afternoon, Mr. Mukherjee. How is the fever today? Are you feeling better?" To this question, the patient would definitely revert and respond by saying, "I am not Banerjee" or "I am not Mukherjee," and the mistake would have been identified immediately on the spot. And this identification of the patient and verification of the identification should be done at various points of transition and administration of patient care, like administration of medication, administration of blood transfusion, taking up of procedure before commencement of surgery, while transporting the patient from one ward to another, while transporting the patient to the ICU, while transport of the patient to other facilities for management like CT scan, PET scan, or to another hospital, and also while transporting to various diagnostic areas like CT scan, MRI, PET scan, so on and so forth. Hence, confirmation of identification of the patient and verification of identification of the patient by establishing various identifiers and utilizing them to confirm the identity would go a long way in prevention of such complications and prevention of wrong identity. Thank you.